Okay, welcome. Welcome and hello to our panel discussion. I'm Delia Lake. I will be your moderator for this session. I'm a longtime resident of Second Life and a friend of Virtual Ability. My work in both Second Life and in the larger solid world we inhabit is consulting and training focused on sustainability. And you'll hear a dog in the background. Um, and that includes integrated environmental, social, and governance issues. Today's topic of no health without peace is so important, not only to each of us as individuals, but also it is essential if we are to have a livable, inclusive, thriving societies that sustain us. Unfortunately, though, not everyone in the world sees the vital importance of health and peace for all. At this conference, we have an opportunity to come together to better understand this complex issue and to share what we are doing and to tell our stories. And who knows, our story might be just the ray of sunshine that someone else needs to light their own way forward. Now, panelists, if you would please also take a couple of minutes to introduce yourselves. Stealth first, please.
Hello, everyone. In real life, I am Jen Dolan and have been on disability for 8 years. I first joined Second Life at the end of 2006 while on short-term disability. Before going on Social Security disability, I worked as a journalist. I taught college courses on communication software and was employed by numerous nonprofits. One of these was a domestic abuse shelter. The last job I held was as an operations manager of a soup kitchen. I have worked a lot with individuals who are displaced and find themselves in uncertain situations. I have also experienced complex trauma as a survivor of childhood sexual abuse and as someone who has experienced mistreatment surrounding my health issues. So those are things I'll be discussing today.
Thank you. Next, KJ Bell.
Thank you so much for having me. And good afternoon, good morning, everyone. Thank you so much for the invitation to speak on this panel. My name is Kimberly Lopez, and I work as an associate professor at the University of Waterloo in Ontario, Canada. And I'm a story archivist, qualitative researcher, and I critically examine social structures that reinforce difference and marginalization. I live with disabilities myself, both physical and mental. As a community engaged qualitative scholar, I value working collaboratively and creatively to know more about how people spend their leisure time, what their self-care looks like to them, invisibility and caring labor, both for ourselves and for others, long-term care homes and the politics around care in those spaces. And then obviously, or subsequently, the leisure that healthcare workers get to experience. I'm also very interested in digital leisure technologies, which is wonderful given the space that we're in today. With a background in facilitating inclusive leisure and recreation experiences, I'm committed to social change through transformational inquiry, inclusive organization, archiving, advocacy, and activism. It's a pleasure to be here with all of you today. Thanks.
Thank you. And Namara.
Hi. Uh, Copy paste. Let's start with that. Okay, so my name is Namara McMorrock here in Second Life. I'm the executive director of the Brain Energy Support Team, commonly referred to as BEST. The BEST provides peer support, education, and skills development for those with brain injuries and their families, as well as a broader neurodiverse community. We are a US-based nonprofit organization, and our major presence is here in Second Line. I am the chief groundskeeper at Utopia Sustainable Communities, and BEST provides discussion groups, activities, and a lot of different events and things at Utopia, and with our partners such as Virtual Ability, Whole Brain Health, and others. Yep, that's me. Thank you.
Thank you all. I will ask some questions of the panelists, and they will also ask questions of each other. We will leave 15 minutes at the end for audience participants to ask questions as well. So please hold your questions and do not type them during the time the panelists are talking. The next 35 minutes will be panel discussion. The challenge to each panelist is to answer questions posed well while still leaving time for other panelists to speak. Okay, I'll start off the questions with one for you, Kim. Okay. You've talked about how the degradation of social systems around the world ensures the continued marginalization of different groups of people, and those with disabilities in particular. Would you talk a little bit about that, please?
Yes, my pleasure. As we've read in the Mentor article, that health inequity is not just about access or outcomes that occur in isolation. Previous speakers have also mentioned this. It's deeply tied to politics, conflict, and what happens when social systems break down. When we talk about health inequity, it's important to remember that it doesn't emerge in isolation. It's deeply tied to that degradation of those social systems. And around the world, we've seen public health infrastructures, social welfare programs, and care networks be steadily eroded. And when those systems weaken, the people who are already the most marginalized, particularly those with disabilities, feel the effects first and most severely. And when we say health inequity, it's not just about unequal outcomes, it's about the systemic stripping away of care infrastructures that could have made inclusion possible. The degradation of those systems that ensures that disability remains a site of marginalization rather than a shared social responsibility. For example, globally, the impacts of the COVID-19 pandemic, disabled people were often deprioritized for care or simply left out of emergency planning altogether. And in low and middle income countries, where health systems are already stretched thin, disabled people face even greater barriers, not because of their impairments, but because the infrastructure wasn't built to include them in the first place. And as we heard from the speakers this morning, when we see war, conflict, or political violence, they're not anomalies, but are structural conditions. And then we have to ask ourselves, how do they degrade the very systems that we rely on for health equity? And so I think back to the article that makes a powerful case about armed conflicts and not simply disruptions. They're political acts that damage healthcare infrastructure. They displace populations and weaken those institutions. More than 740,000 people die each year as a direct result of conflict-related violence, and that doesn't capture secondary deaths. Untreated infections, lack of clean water, destruction of sanitation systems, or the collapse of maternal health care. They put it plainly, really, and it's so poignant that there can be no health without peace, and there can be no health without justice, and there can be no health without equity. So I think outside of full-blown war, many countries have fragile or underfunded systems, and cuts to social services, austerity policies, or political instability have similar effects, even when no bombs are falling. I think about the underfunded community health clinics, the poorly maintained accessible infrastructure, the mental health support services that serve disabled, or marginalized people. And in fragile and deprioritized systems, we're the most vulnerable. When disaster or public health strikes, those most marginalized suffer disproportionately because the buffer was already so thin. And so when we build or reform health systems, we must see rehabilitation or disability inclusive planning or resilient supports as part of peace building or post-conflict programming. Otherwise, rebuilding simply reproduces exclusion. We know that health inequity is simply not about unequal access to doctors or medicine. Sometimes it's about the absence of possibility. When systems are meant to support everyone are degraded by conflict, politics, or neglect. The No Health Without Peace framing reminds us, unless we're able to secure peace, protect infrastructure, but build inclusive systems, pardon me, we risk rebuilding inequity as we rebuild health. Thanks, and a thought.
Oh, thank you. Stealth. I mean, it's clear from what Kim just said that there are many people whose basic needs are not met. You use Abraham Maslow's hierarchy of needs as a lens to understand this. Can you briefly tell us about how you apply this?
I will begin by offering a link for background on Maslow and his hierarchy of needs model. And so I use this one from positivepsychology.com. I think it's pretty good. When we think of peace, we likely think of those situations that are opposite. Situations such as war, displacement, domestic violence. There are so many situations where peace does not exist, and so those most basic needs are not being met. If we think of someone who is living in a war-torn region or as a refugee, they are likely not getting their physiological and safety needs met. We see these people displaced from their homes without access to food and medicine. This may also be the case for someone in an abuse situation. When these most basic needs are not being met, the higher needs are simply less of a concern. While it is easy to see the lack of peace and therefore lack of health when people are being denied those basic needs, we might see similar outcomes for people whose most basic needs are being met. So we're going up that hierarchy. If we look at that next tier, belonging, we can think about the epidemic of loneliness and isolation. The American Medical Association identifies individuals facing loneliness and isolation as being at greater risk of premature death. A sense of inner peace is threatened not only by loneliness, but for sufferers of trauma. That said, trauma often resurfaces when times are good or when most of our needs are met. I am merely saying most because I sincerely believe that as sufferers of trauma, we cannot self-actualize until we reclaim our narrative, and by doing so, we can start to achieve that inner peace. I am not only talking about professional narratives therapy, we can reclaim the stories around our trauma in numerous ways. Think about Take Back the Night events for sexual assault survivors, art therapy, journaling. There are many ways to reclaim one's narrative. So that's how I'm applying Maslow.
Thank you. Nam, from your perspective, what would you like to add to this topic, no health without peace?
Thank you, Delia. First, I want to thank everyone who presented and shared their expertise, their experiences, and their suggestions on this topic. And as I've listened to things, and as I've listened to Kay and Stealth also talk, there are a lot of really valid points that have been made so far. That said, okay, um, that said, having a disability does not mean that a person's not healthy, but it does, however, mean that access um, to appropriate and affordable health care, especially here in the United States where I'm located, is difficult. And I just want to share that in the US, those with a disability are twice as likely to be a victim of violence than non-disabled persons. Now, you may not be aware, but individuals with cognitive challenges, for example, are 7 times more likely to be sexually assaulted. This doesn't make someone feel safe or have a sense of peace. The most repeated experience that I've personally had regarding brain injury uh, is around the way people are treated because of the nature of hidden disabilities like this. And I can't tell you how often I've heard someone say, "You don't look like you have a brain injury," or "You're really smart for someone with a disability." And as many of you already know from your own experiences, either as an individual with a disability or as an ally or a caregiver, family member, the list of um, microaggressions as well as overt um, issues or bad behaviors, comments, it just goes on. And the hardest part of that dynamic is that the healthcare system, as has been pointed out by both Kay and Stealth, is just as prejudicial in their assumptions. And, and let me just grab the last part of this. Right. So, for example, I know that I've been moving a little bit slowly, but I hope I'm not taking too much time. My wife experiences terrible headaches since her injury, her brain injury, 20 years ago. And when she would talk to her doctors at the time about it, they attributed it to migraines, which, as we know, is not a headache, but that's another story. One urologist told her it was depression. And I hear these kinds of stories all the time, and I share it, excuse me, because misdiagnoses like these mean that incorrect medical treatments are prescribed, which is harmful on so many levels, as well as it um, continues to marginalize individuals that need specific kinds of care and support that they may not be getting in a broader context. So the points that Stealth and Kay shared are all examples, along with what I've shared, that illustrate the numerous situations in which there is a lack of peace without health. And I work in a community context versus, an international or global conflict context. So that's where I come from. Thank you.
Thank you. Given what your fellow panelists have said, what questions do each of you have for either of the other panelists? Please put your questions in chat with the panelist name you'd like to have answered. And please excuse the dog in the background.
So my question is for KJ or Kimberly. I like how you point out that equity goes beyond equal treatment, that people with disabilities often need additional equipment or resources just to gain access to the same opportunities as able-bodied individuals. Many things that benefit the disabled also benefit able-bodied individuals, such as automatic doors. What about those things that able-bodied people deem as perks and sometimes try to encroach upon, something like disabled parking, special seating at events? Is there a way where we can better communicate that this is not preferential treatment, but equitable treatment?
Micah, stop. No.
They just want to be part of the conversation we're having. Thank you so much for the question. I think it's a very important one. Yes, I think there needs to be a massive reframing of this narrative from these are conveniences for some, but it's about access for a few, and I think we need to start making that demarcation more strongly. I think about service dogs at airports that are not service dogs, so to speak, that we see, and how it becomes a matter of convenience to travel that way when your dog is not trained or is intended to operate in that capacity. It's such a thoughtful question that we have to kind of challenge and call others to be a part of thinking through it. And so when we think about priority seating or accessible entrances, these aren't bonuses, they're mechanisms of access that make participation possible for everybody. And without them, many disabled people would be excluded altogether. And so these are structural correctives and they're not privileges. They are meant to level, not even level the playing field, but offer a point where they can enter the field in an environment that was originally built without disabled people in mind. And so we can start to think about ways we can reframe the message around these spaces as it's the difference of between entering a building or being left outside. It's not a convenience; it offers entry. So I think there's a scarcity mindset that happens, and we need to challenge this, acknowledge that it exists, and then challenge that mindset. Because it almost feels for some folks who have more access or have full or are able-bodied that have mechanisms to not use these spaces. There's this false sense of scarcity that by accommodating others, it somehow takes away from somebody who requires accommodations. And we can challenge that by pointing out that equity doesn't redistribute privilege, it redistributes access. And so when systems are designed inclusively, everyone benefits. So smoother navigation, clear signage, more flexible design means safer spaces. And I think that messaging needs to be very clear to folks. So accessibility isn't about giving people more, it's about ensuring everyone can participate in public life. And that with dignity for sure. And so I think, so just ensuring that the language of design and the way we're creating those frames of relating to one another is important to emphasize and re-emphasize by thanking people for creating the space and for respecting the need for these access points to be available when they're needed by whom needs them. And so, and reconnecting it to the social model of disability, that it's not in the individual body, but it's in the environment. And these barriers prevent participation. So I think there needs to be some collective and interdisciplinary reframing and other mechanisms of emphasis around all of our social responsibility to ensuring that all folks have access in different ways and as needed. Thanks so much.
I just real quick have a question. I'm going to do this the way I wrote it, though. Equity, as Kim talked about it, is really important, and I agree. The degradation of our social systems, the thinness of those buffers, and I really appreciate that you talked about that today. But I'm actually about to put stealth on the spot, and I hope that's okay. Well, I hope I'm not really putting you on the spot. Um, you talked about royal, royal, rural healthcare, specifically, and I read this a little earlier about the dearth of emergency medical services, and also the need for hospitals and medical providers in these communities to have access to reliable internet. My question is, do you think, from your own experiences and your own work in the community, that there are specific community initiatives maybe that we can support or even introduce that addresses the needs of those with disabilities, especially in a situation where access and resources continues to shrink?
Well, thank you, Nam, for that question. I haven't talked about it yet. That's the. I know we were talking pre-conference about this, but I will be talking about it. Yes, it's a big issue
I hope
for
it's
me.
okay that I brought it.
So I think one of the big things that communities can do, and it's something I propose to, especially certain small town leaders, town boards, consider reaching out to your to the people in your community about if they would be willing to maybe it could be paid as part of property taxes or part of maybe even a utility fee, um, just to introduce municipalized Wi-Fi so that there is actually internet in a community, that's not relying on some um, some very spotty satellite connection. Like I know a lot of rural communities have used HughesNet and it's not the most reliable, certainly not reliable enough for hospitals and clinics. So that's one thing where I think uh, a local municipality could actually do this themselves without having to have the state government or federal government help facilitate. I mean, the idea would be to expand broadband. We saw that start. And unfortunately, a lot of those projects um, have have been killed. And but it's been a big thing for over a decade in Wisconsin. There's been a push that's in this state has been bipartisan, even if at the federal level it seems to be much more partisan. So, another thing that's being done here in Wisconsin is there is a push for clinics to be headed up by um, advanced practice nurse practitioners. So there wouldn't have to be a doctor, an MD, as the chief. So that could expand clinics as well, because they're just, when we look at the schools, they're churning out more APNPs. And it's something I hope that we see personally. I mean, there is a bipartisan push for that as well. I know it's actually my state senator, who is a rather moderate Republican, has really been at the forefront of pushing for that. So those are a couple ways.
you. Other questions?
I have a question that any of the four of you can answer, or even people from the audience. We heard in a previous session a speaker claim, I'm not disabled, my environment disables me. I can't remember the exact words, something like that. How can we, as disability advocates, flip that discussion to look at equity from the other point of view? I've seen that cartoon that demonstrates equality versus equity. There's three kids, a tall one, a medium one, a short one. They're standing on a box, trying to look over a fence to see a ball game. And of course, the tall kid can see it, but the short kid, even standing on the box, can't see it. I was wondering what would happen if we turned that cartoon around and looked at the kids, and you'd see that one was hanging up over the fence, and you wouldn't even know there was a short kid hidden by the fence. What can we do to flip the whole vision of equity around?
So it's interesting that you have raised it this way. I didn't include it in my intro, but one of the things that I've had the privilege to do in RL is to work with the Rutgers University Institute for Social Innovation, corporate social innovation. And for a couple of years, we have had some health focused symposia. And one of them is the social determinants of health. And this is really touches in this area. So how do you build a culture of health that includes everyone? And that doesn't look at one kind of ability as better or worse than another kind of ability, because we all have abilities and things that we don't do as well. And so in a very real sense, this is a social challenge and a social issue. And I think it starts in the individual communities. I don't think we can legislate this nationally if we don't have advocates and allies, because we need both in our local communities.
So I know the cartoon you're talking about, Gentle, and I think if we see on the other side of that fence, the short kid is definitely invisible. There's a lot of us with invisible disabilities, or where we quite literally become invisible because we're not given access to attend things in ways that are doable. So for me, when I am out and about, and it's on a rare occasion, a lot of times people will say, "Oh, you look good. You look like you're doing good." Yeah, but you don't see me very often, do you? And that's telling. But I am seeing more if I can interact in a place like Second Life or over a Zoom meeting. Having those ways, it's much more accessible for me. When I was writing that question earlier for KJ, I was trying to think about all those things that benefit, that were designed for people with disabilities, but benefit able-bodied. Certainly work at home benefits everybody. Absolutely everybody. I know there are managers business owners who will argue that point, but honestly, you are saving money you're saving a lot of overhead by having people who can work from home, and a lot of times you can cut that middle management staff that, I mean, they're basically babysitters, and the competent workforce does not need that. But that's my editorializing on that.
Mhm.
That's all I
So
had
for-
to add.
I have a
Thanks, Del.
thought, if I can jump in. Hey, did you want to say something or?
Sure. I was just going to say, I was just going to say quickly that as an abolitionist, I would recommend taking the fence away altogether, and thinking about ways we could create alternative kinship formations and rely on the collective to support one another. I know that's difficult to put in practice given capitalism and the isolation that the capitalist relations place upon us, but the more we can create community, the better, the stronger we all are for it. Thank you.
Yeah. Just to piggyback on that real quick, I agree with you. It's got to be community based, which I think is something all four of us have been trying to stress. And, you know, Delia brought up the social determinants of health, and it made me think of Erica Muniz's presentation first thing this morning, where she did talk about that. And I'm not going to repeat her presentation. I'm just going to take a couple thoughts that I have and copy and paste them into the chat. So I'm not going to repeat her presentation. Definitely a video worth watching, but I bring it up in the context of what we've been talking about and with the question that Gentle posed, because employment, education, housing, safe spaces, these are all community based. We don't need federal government or politics to, okay. So they're community based. Let's leave it at that before I go off into the woods and get lost. Um, these are often barriers for our community as well as the broader disabilities community. And I also think that the longer our relationship with the non-human world around us remains as broken as it is, the equity of our social systems will continue to degrade. Creating safe spaces with the right community support, healthcare systems, food security, which we haven't even touched on, all contribute to a sense of peace. So creating peaceful, engaging, safe spaces is what we're focused on providing here in Utopia, here in Second Life, as an extension of the physical world work we've done over the years. And I think it's important to know that, oh yeah, well, that's essentially what I wanted to share. Thank you.
I have a further question to ask here. And after we think about this question, Stealth has a poem to read before we go to further audience participation. But here's my question.
Is it okay if I begin?
Yes.
Okay. So you're asking, while there can be no health without peace, seems to me that the converse is equally true. There can be no peace without health. And I'd like to address this by talking about the situation with rural healthcare and healthcare overall. I think this is why healthcare needs to be classified as not only a human need, but a basic human right, and should be available to everyone in every nation. In the United States, there are many threats to healthcare accessibility. Not only are health insurance premiums becoming less affordable, but we see rural hospitals shuttering because they depend on Medicaid dollars, which are being cut, along with the killing of broadband internet expansion into these communities. I live in Wisconsin, home of Epic Systems, the top medical database company based on market share. It is imperative that hospitals and clinics have access to high-speed, reliable internet. One of the biggest issues threatening peace in rural areas of the United States is the dearth of emergency medical services in these areas. If you live and work in a rural area and you experience an emergency, the nearest ER could be 40 miles, that's about 64 kilometers away or even more. We need our farmers. It is a job that cannot simply be replaced by AI, or at least not entirely. It is a job that comes with risks, and knowing that if something happens to you, there is a great likelihood that you could die on the way to the nearest ER, how can you be at peace with that? You know, I didn't list all the jobs I had in my intro. I know it's a lot, but when I was in college, I took a lot of different jobs to help pay for my education. I have done factory work and know that it is hard, but I have also been a farm laborer. There is no job that is more difficult than farming. I say that as someone who has worked in education, including teaching middle schoolers. The health of our farmers needs to be a priority.
Yes. Yes. Absolutely. I'm also thinking of it from a larger cultural perspective. And if you have a culture that is unhealthy, that does not include everyone, where large groups of people do not feel they belong, do you have a healthy culture? And can you really get to peace if you have a culture that isn't healthy? While we're pondering that, yeah. Yes, I think that's true too, Nam. Yes.
Yeah, I'm sorry. You were talking and the thought came to me, and I have a tendency sometimes when shooting from the hip that I have this confluence of thoughts in my brain. It's the way my brain works, which is why I like to have things planned out. But I really wanted to share that we have to stop thinking in terms of us and them. Not that anyone here has, but I'm saying in a more general context. And I do believe that that's one of the first steps to a healthier culture. I also wanted to share something while I was doing some reading. I actually went back and I looked at Bells of Nagasaki, which um, had to do with the uh, atomic bomb attack on Nagasaki during World War II. I've never read a more deeply moving personal experience than this doctor's um, book. Anyway, but looking back at that and then reading some of the other studies that have been done globally, right? There was one I read. It was how political engineering can make health a bridge to peace. This case study analyzed um, a primary health care project in Myanmar's border areas, and it focused rather on the peace building in addition to service provision and the impacts. So the study demonstrates that health plays a valuable role in peace formation. So, like we've been talking up to this point about, we can't have peace without good health. There's a symbiotic relationship, I think, there, that it's not one precedes the other. It's that they're really a bridge for both. But this article was interesting in how to use healthcare and um, uh, service provision in as a bridge to forming peace in strife-ridden areas, because I know we're also in that kind of a context looking at doctors, for example, learning how to use guns to protect patients and defend their clinics and such. So
Mm-hmm.
thank you. Thank you for the link, by the way, Gentle. Thank you. That's
Yes.
it.
Yes. I want to add something else here, and this goes to something Stealth said and something she's done here, and that there are many ways to health, to achieve health. And one of the paths to health that she has taken that I think is wonderful is to reclaim your own narrative. And to that end, Stealth has written a poem that I think she's willing to share with us. Would you read that to us, Stealth?
Yes, the poem is available on note cards. I believe everyone, if you want to keep it, you can accept it. If you don't want to keep it, that's fine too. So this is an example of some of the writing I've done to reclaim my own narrative. And it's a poem I titled 2023. Took a year to address my trauma. I was tired of being controlled by the drama. I reclaimed my story and made it my own, reinforced this foundation built on these good bones. But then I was asked what I had been up to, a difficult question because so many never knew. I kept quiet about all the shit that I had gone through. Breaking my silence had been a decades overdue. When you're a survivor of such a rare disease, your story can seem hard to believe. The way I was abused is not what most people think. Unexpected led to neglecting the truth I would seek. It was the end of a pandemic and maybe a new start, the end of my silence and the reclaiming of my heart. Justice is elusive, and it still slips from my grasp. Naming my assailant could be slander, so I must settle for truth at last. Don't owe that bitch my guilt, silence, or shame. Why does it matter if I ever say her name? I was 8 years old, left in the care of one I loved. 8 years old, didn't know too much of life and all the ugliness that little girls often face. In one afternoon, she had destroyed the whole place. So I ran and I cried. My childhood had died. I buried the memory, hid it down deep inside. I built these walls around myself and walls around others too. The things she did to me, I'd make sure she wouldn't do again. Now the walls have given way and new light has broke through. It is time to move along as much as I am able to. Time to find my voice, time to make a choice, time to reclaim time and time to rejoice. I cleaned out this closet and got rid of these old clothes. The guilt, the pain, the shame are things she now owns. I found a way to finally be free. That is how I spent my 2023.
Wow. Thank you. Thank you. Very powerful. We do have questions coming in from the audience, and if I could put the ones that I have so far in chat, and we could then talk about those, and there may be more coming in, but I have a couple here in chat.
So while you're doing that, can I just want to make one comment, and this is the political side of me.
Oh yeah.
Until we, and I've seen this, I've traveled extensively internationally. I'm not just talking about the United States, but until we can embrace, appreciate, respect, and support women and girls, we will have such heart-wrenching stories.
Yes.
And so, thank you so much, Steph, for doing this and sharing your journey with us. Michael.
Yes, thank you. So we'll pivot for a moment. We will never forget the poem. So we will pivot for a moment and take a question here from Idiko. Let me say before somebody else speaks here that this is one of the reasons that I mentioned allies. That the change in the societal norm and the ideas here should not rest entirely on the shoulders of the person or persons who with disabilities. That it is up to allies who don't have those same disabilities to also speak up and speak out, and to push for change.
I would like to address Idiko's question. And I know Idiko and I live together. Maybe not everyone here knows that, but it's something that we talk about. And the way I want to address it is I think this is a good argument against the sheltered workplace. We need people with all kinds of disabilities to be seen, to be integrated into the community at large, so that you know, in some ways that's kind of sad that people need to be made aware of differently abled people amongst them, but it's definitely something that's needed for us to be better understood, for us to be included. And I mean, so many people who've gotten to know Idiko in real life, they're astounded by all the things he can do as someone who's visually impaired. Now with me, my disability is largely invisible. I have multiple sclerosis. Things are becoming more visible now that I use mobility aids. But it's like people, I think sometimes it's the opposite with me. People still think I can do way more than what I'm actually capable of because they remember that old me, and maybe they see me and I don't look much different. But yeah, it's just about, it's hard to broaden understanding without being seen.
I just want to jump in real quick. I'm not going to type. I don't have a preset answer. So uh, if someone could just briefly transcribe this, maybe Katie, I'd appreciate it. When we talk about being seen or not being seen, I think that especially when, like my community that I work with, individuals with cognitive challenges, as a result of a brain injury, whether that's a traumatic brain injury or a stroke or an aneurysm or, the list goes on, but that we are able to ask for accommodations, to raise awareness, and along with our allies, as Delia pointed out, without sounding like uh, I'm having difficulty finding the right word. I want to say needy, but that's not quite the right word. So the difficulty is when someone looks at us as an individual with a disability, there's that condescension or that pity or that what they might view as compassion sneaking in. And what people on the whole, I think, need to realize is that everyone asks for accommodations at work. I would like to, or we book airplane flights with accommodations in mind. I need to sit near the aisle because I go to the bathroom a lot, or I don't want my cubicle over there because it's too much traffic. I can't concentrate on my work. These are all kinds of accommodations, and if we need a special screen for our computer, or we need to see the dentist in a private office, these accommodations we're asking for as a way to interact with the world around us, not in a. I think you understand what I'm trying to say, and how important it is that our allies, ourselves, our employers, our educators, etc., can be that bold, if you will, because then we're taking it away from it's an individual with a disability who needs a specific uh, accommodation or level of, you know what I mean? It's that we all need different accommodations to work well in the world with one another. And from that point, we're able to integrate or reintegrate um, into a social context and be successful. And I hope that made sense.
I love the points you bring up, Nam. Got me to thinking because Idiko and I talk about this, what accessibility really means. And I've said that accessibility doesn't necessarily mean that someone else does something for me. I mean, sometimes I need that. Sometimes we all need that. Everyone, even if they're able-bodied, not everyone has the same skill sets, But what I often say is accessibility is getting me the help so that I can do the things that I want and need to do. So whether that's, using accessible technology or, for example, Idiko helps me so that I can still garden. I have raised beds, but he helps do the heavy lifting for me when it comes to the bags of, soil amendments, that kind of stuff. And, and also helps get me water from the rain barrel so that we can water the beds without using so much of the municipal water. But it's one of those things where, there's all kinds of accessibility devices out there, and there's all kinds of supports. It's not that people with disabilities just want people to do things for them. We want to be vital parts of communities. We want to be, we want to be in the room with someone. We don't want to be left out of things. But sometimes that means, having access in different ways.
Can I just jump on Tom's comment or question? I think what it comes back to is not seeing us and them as much as what Stealth just said. Everyone needs a certain level of, I'm going to say, assistance to some extent. So, for example, I wear glasses. I've been wearing glasses since I was 7 years old. I need certain accommodations to support my vision. And yes, well, there you go. My disability may be your ability, and like Stealth was saying, we have skills that complement one another. So whether that's an individual with um, cognitive or physical challenges, or whether it's someone who would be considered um, completely able-bodied, which I don't believe in personally, but that we are able to just work together and raise awareness of what our universal needs are and how we can support one another in any set of circumstances. And I think going back to environmentalism, which I know is not today's subject, but the further removed we are from that relationship of the non-human world around us, whether it's animals, water, the air that we breathe, the plants that we walk past every day or that I talk to every day, uh, that relationship needs to be healed. And as that's healed, the relationship between humans, I also believe, is we can have healed. And then there won't be that feeling that you need to do something special or, yeah, well, that's it.
Wow, the time just goes so fast with such good discussions. It's amazing. My head is swimming as much as Namara's is, I think. But I think we should thank the panel, and I, I can't even think of the words enough to thank you for all the ideas that you've shared with us. It's just amazing.